Throughout history, medications have been designed to save lives, offering hope and relief to millions suffering from various ailments. From antibiotics to painkillers, these drugs have revolutionized healthcare. But what happens when the cure becomes worse than the disease? When the very medications meant to heal us turn into silent killers, causing more harm than good? Some drugs, once prescribed by doctors and trusted by patients, have been banned due to serious, even deadly health risks. These medications, initially hailed as breakthroughs, later revealed their dark sides. These aren't just isolated incidents. They're stark reminders that the system isn't perfect. The rigorous testing and approval processes sometimes fail, leading to catastrophic consequences. Today we're uncovering the shocking truth behind medications that were pulled from the market, what they did, how people were affected, and the aftermath of these medical disasters. We'll delve into the stories of those who suffered and the ripple effects on the healthcare industry. Buckle up, because things are about to get bleak. The journey through the dark side of pharmaceuticals is a sobering reminder of the delicate balance between healing and harm. Picture this. It's the late 1950s, and a new drug hits the market, promising to alleviate morning sickness in pregnant women. This drug was seen as a breakthrough, a beacon of hope for countless expectant mothers who struggled with debilitating nausea. Sounds like a godsend, right? Enter thalidomide, a drug that, at first glance, seemed about as threatening as a warm glass of milk. It was marketed aggressively, with advertisements showing smiling mothers and reassuring doctors. Marketed as a safe and effective solution for morning sickness, thalidomide quickly gained popularity among expectant mothers and their doctors. It was available over the counter in many countries, making it easily accessible. It was hailed as a miracle drug, a beacon of hope for women suffering from the debilitating nausea and vomiting that often accompany pregnancy. The relief it provided was almost immediate, and it seemed like a perfect solution. What could possibly go wrong, right? Well, as history tragically reveals, plenty. The drug had not undergone rigorous testing, and its long-term effects were unknown. This so-called miracle drug interfered with fetal development, leading to a devastating wave of birth defects. The extent of the damage was not immediately apparent, but soon the horrifying truth began to emerge. Thousands of babies were born with phocomelia, a condition characterized by shortened or absent limbs. The sight of these children was heartbreaking, and the medical community was at a loss for how to address the crisis. Imagine the unimaginable. Bringing a child into the world, only to be met with the crushing reality of their pain and suffering, the result of a drug that was supposed to help, not harm. Parents were devastated, and the emotional toll was immense. The impact was catastrophic, leaving an indelible scar on families and the medical community alike. The scandal rocked the pharmaceutical industry and led to widespread outrage and demands for accountability. Over 10,000 babies were affected worldwide. The scale of the tragedy was unprecedented, and it highlighted the need for stricter drug regulations. Many didn't survive infancy, their tiny lives tragically cut short by a drug that was supposed to ease their mother's suffering. The loss was immeasurable, and the grief of the parents was profound. Those who did survive faced a lifetime of challenges, navigating a world not built for their bodies, forever marked by the devastating consequences of thalidomide. They had to adapt to their physical limitations and often faced social stigma. The scandal sent shockwaves across the globe, exposing the glaring inadequacies in drug safety protocols. It led to significant changes in how drugs were tested and approved, aiming to prevent such a disaster from happening again. The legacy of thalidomide serves as a chilling reminder of the importance of vigilance, the need to constantly question and scrutinize to ensure that history doesn't repeat itself. It underscores the critical role of regulatory bodies in safeguarding public health. Fast forward to the 1990s, a decade obsessed with thinness, where the pressure to conform to unrealistic beauty standards fueled a booming diet industry. The media was saturated with images of supermodels and celebrities, setting an almost unattainable benchmark for the average person. It was a time when fat-free everything lined grocery store shelves and the pursuit of the perfect body reached a fever pitch. Diet fads came and went, each promising miraculous results, but often delivering disappointment. Enter Fen-Phen, a combination drug touted as a revolutionary weight loss solution. It combined fenfluramine and phentermine, two drugs that were believed to work synergistically to suppress appetite and promote weight loss. It was the answer to every dieter's dream, a way to shed those unwanted pounds quickly and effortlessly. Advertisements painted a picture of instant success, showing smiling faces and dramatic before and after transformations. Millions of people, desperate to fit into society's narrow definition of beauty, flocked to Fen-Phen, believing it was a safe and effective way to achieve their weight loss goals. The drug's popularity soared, and it became a household name almost overnight. Doctors, caught up in the hype and bombarded by pharmaceutical companies eager to push their miracle drug, readily wrote prescriptions. The medical community was convinced by the aggressive marketing and the seemingly positive initial results. It was a win-win, or so they thought. Patients were losing weight, doctors were seeing happy clients, and pharmaceutical companies were making a fortune. But beneath the surface of this weight loss craze lurked a sinister secret. The initial euphoria was masking a growing number of reports about adverse effects. It turned out that Fen-Phen was hiding a deadly side effect, one that would leave a trail of broken hearts and shattered lives in its wake. The drug was causing serious heart valve damage, a condition that could lead to heart failure. The drug, hailed as a breakthrough in weight loss, was actually a ticking time bomb, silently damaging the hearts of those who took it. The combination of fenfluramine and phentermine was proving to be far more dangerous than anyone had anticipated. Thousands of people who had turned to Fen-Phen to feel better about themselves were now facing a terrifying reality. Their miracle drug was slowly killing them. The very solution they had trusted was now their greatest threat. Reports began to surface of patients experiencing heart valve problems, a devastating side effect that could lead to heart failure. The medical community was slow to react, initially dismissing these cases as isolated incidents. The once celebrated weight loss wonder drug was now the subject of scrutiny and fear. Media outlets began to report on the growing number of affected patients, and public confidence in Fen-Phen started to wane. As more and more cases emerged, the evidence became impossible to ignore. Medical journals published studies linking Fen-Phen to heart valve damage, and the outcry from the public grew louder. Fen-Phen wasn't just causing minor side effects, it was causing life-threatening heart damage. Patients were undergoing surgeries, facing long-term health issues, and in some cases, losing their lives. The lawsuits came pouring in, a deluge of anger and despair from those who had trusted their health to a drug that had betrayed them. Legal battles ensued, with patients seeking justice for the harm they had suffered. In 1997, after years of wreaking havoc on unsuspecting patients, the FDA finally took action, pulling Fen-Phen off the market. The decision came too late for many, but it was a necessary step to prevent further harm. But the damage was already done. The legacy of Fen-Phen was one of broken promises and broken hearts, a stark reminder of the dangers of rushing a drug to market without fully understanding its risks. Thousands of people were left with permanent heart damage, their lives forever altered by a drug that promised so much, but delivered only suffering. The story of Fen-Phen serves as a cautionary tale about the perils of the diet industry and the importance of rigorous drug testing. Let's talk about pain, that universal human experience that unites us all. From headaches to chronic back pain, it affects millions daily. Pain can significantly impact our quality of life, making even the simplest tasks feel insurmountable. When a new drug promises relief, people embrace it with open arms, hoping for a return to normalcy. Vioxx, introduced in 1999, was a beacon of hope for millions suffering from arthritis and other painful conditions. Developed by Merck, it became widely prescribed, quickly becoming a top-selling drug. Patients experienced newfound freedom, able to engage in activities they once thought impossible. Vioxx seemed like a miracle, restoring quality of life for countless individuals. But whispers of danger emerged, casting a shadow over its success. Reports linked Vioxx to heart attacks and strokes, raising alarm among the medical community. Despite warnings, Merck continued to sell Vioxx, prioritizing profits over patient safety. In 2004, after many deaths, Vioxx was pulled from the market, leading to a massive scandal. The scandal exposed corporate greed over patient well-being, shaking public trust in the pharmaceutical industry. Merck paid over $4.85 billion in settlements, a significant but insufficient compensation. A drop in the bucket compared to the loss of life and trust, leaving a lasting impact on the industry. Let's be honest, acne sucks. It's not just a cosmetic issue. It can severely impact one's self-esteem and social interactions. It's the bane of many a teenager's existence, and for some, it continues to plague them well into adulthood, affecting their confidence and mental well-being. The quest for clear skin has fueled a multi-billion-dollar industry, with countless creams, lotions, and treatments promising to banish blemishes and restore that coveted, flawless complexion. Yet, many of these products offer only temporary relief or none at all. Enter Accutane, a powerful prescription drug hailed as a miracle cure for severe acne. It was developed in the 1980s and quickly became the go-to solution for dermatologists. For those who had endured years of painful, embarrassing breakouts, Accutane was a godsend. It offered a level of effectiveness that was previously unheard of in acne treatment. It worked wonders, clearing up even the most stubborn acne and offering a glimmer of hope for a future free from the tyranny of blemishes. Patients reported dramatic improvements in their skin within just a few months. But this seemingly miraculous transformation came at a steep price. Accutane's potent formula was not without its risks, and the side effects were far from trivial. Accutane, while incredibly effective at banishing pimples, had a dark side, a sinister undercurrent that could drag its users into the depths of despair. The drug was linked to severe psychiatric side effects that were alarming. The drug, hailed for its skin-clearing abilities, was linked to a range of psychiatric side effects, including severe depression, suicidal thoughts, and even suicide itself. These side effects were not immediately apparent, making them even more insidious. Imagine the horror. A drug intended to boost self-esteem and improve quality of life was actually pushing some users to the brink of despair. The emotional toll was devastating for many. Reports began to surface of patients experiencing extreme mood swings, withdrawing from loved ones, and harboring dark, disturbing thoughts. These symptoms often went unnoticed until it was too late. In some tragic cases, these thoughts spiraled into action, leading to devastating and irreversible consequences. Families were left to grapple with the loss of their loved ones, often unaware of the risks associated with the medication. The FDA, faced with a growing body of evidence linking Accutane to severe psychiatric problems, took action. They conducted extensive reviews and held public hearings to address the mounting concerns. They slapped the drug with a black box warning, the strongest warning the FDA can issue, highlighting the potential for serious mental health risks. This was a significant step in raising awareness about the dangers of the drug. Despite the controversy and the undeniable risks, Accutane remained on the market, a testament to its effectiveness in treating severe acne and the desperation of those seeking clear skin. The debate over its safety continues to this day, with some advocating for its benefits and others warning of its potential dangers. Heartburn. A common ailment that affects millions worldwide, causing discomfort and pain that can disrupt daily life. That burning sensation in your chest, that sour taste in your mouth. It's a familiar and unwelcome experience for many. It's enough to make you swear off spicy food forever. But for those who love their culinary adventures, giving up their favorite dishes isn't an option. For decades, Zantac was the go-to solution for millions seeking relief from the fiery wrath of heartburn. It was marketed as a safe and effective remedy, trusted by consumers and healthcare professionals alike. It was available over the counter and prescribed by doctors, a seemingly innocuous little pill that promised to extinguish the flames of indigestion. Its convenience and effectiveness made it a household name. People popped Zantac like candy, trusting in its ability to soothe their stomachs and restore digestive harmony. It became a daily ritual for many, a small act of relief in their busy lives. It was a staple in medicine cabinets worldwide, a testament to its effectiveness and widespread use. Families relied on it, and it was often recommended by friends and family members. But behind Zantac's harmless facade, a sinister truth was brewing, a ticking time bomb that would shatter the illusion of safety. The very medication that was supposed to bring relief was hiding a dangerous secret. In 2019, the world was hit with a bombshell revelation. Zantac, the beloved heartburn remedy, contained unacceptably high levels of NDMA, a probable human carcinogen. This discovery sent shockwaves through the medical community and the public. Suddenly, the little pill that people had been taking for years, the one they trusted to alleviate their discomfort, was linked to cancer. Panic ensued. The trust that had been built over decades was shattered in an instant. People who had relied on Zantac for years, those who had ingested countless pills, were now facing a terrifying reality. Their trusted heartburn remedy might have been silently increasing their risk of developing cancer. The fear and uncertainty were overwhelming. Lawsuits erupted like volcanoes, a fiery outpouring of anger and fear from those who felt betrayed by a drug they believed was safe. The legal battles were intense, with many seeking justice and answers. The fallout from the Zantac scandal continues to this day, with ongoing lawsuits and investigations seeking to uncover the extent of the contamination and the potential long-term health consequences for millions of people. The story of Zantac serves as a stark reminder of the importance of drug safety and vigilance. In this chapter, we will explore the future of pharmaceutical regulations and how they aim to prevent such drug recalls. The landscape of drug safety is evolving rapidly, driven by both technological advancements and a growing awareness of the need for stringent oversight. In the wake of numerous drug scandals, regulatory bodies worldwide are tightening their oversight. This includes not only more frequent inspections, but also the implementation of more comprehensive guidelines that pharmaceutical companies must adhere to. Enhanced testing protocols, stricter approval processes, and more rigorous post-market surveillance are now becoming the norm. These steps are designed to identify potential issues at every stage of a drug's life cycle, from initial research to post-market monitoring. These measures aim to catch potential risks before they reach the consumer, ensuring that only the safest medications make it to the market. Quality control has become a critical focus, with new technologies being employed to detect even the smallest anomalies. But it's not just about regulations. The collaboration between regulatory bodies and pharmaceutical companies is essential for creating a safer environment for drug development and distribution. Technology is playing an increasingly vital role in ensuring drug safety. Innovations such as AI and blockchain are revolutionizing the way drugs are tracked and monitored, providing unprecedented levels of transparency and security. Advanced data analytics, artificial intelligence, and blockchain technology are being harnessed to track and trace every step of a drug's journey, from the lab to the pharmacy. These technologies help in identifying patterns and anomalies that might indicate potential safety issues. These innovations are helping to identify potential issues more quickly and accurately, minimizing the risk of harmful drugs slipping through the cracks. The integration of these technologies into everyday practices is setting new standards for the industry. As consumers, staying informed is more important than ever. With the vast amount of information available online, it's crucial to know how to discern credible sources from unreliable ones. The internet has made it easier to access scientific studies, drug reviews, and regulatory updates. Use these resources wisely to make informed decisions about your health and the medications you take. Join patient advocacy groups, participate in forums, and don't hesitate to consult multiple sources for information about your medications. Being proactive in your healthcare can make a significant difference. Remember, the future of pharmaceutical safety is a collaborative effort. It requires the combined efforts of scientists, regulators, healthcare providers, and patients to create a safer pharmaceutical landscape. Regulatory bodies, pharmaceutical companies, healthcare professionals, and consumers all have a role to play. Each group brings a unique perspective and set of skills that are crucial for ensuring drug safety. By staying informed and vigilant, we can help ensure that the medicines we rely on are as safe and effective as possible. Together, we can build a future where drug recalls are a rarity and trust in pharmaceuticals is restored. These cases, as unsettling as they are, serve as a stark reminder that even in the realm of modern medicine, where advancements and breakthroughs are constantly being made, there's always an element of risk. The rapid pace of innovation sometimes means that long-term effects aren't fully understood until it's too late. These medications, once trusted by millions, highlight the importance of informed consent, of understanding that every drug, no matter how benign it may seem, carries the potential for unintended consequences. It's crucial to stay informed about the medications you take and to be aware of any updates or recalls. So, how do we navigate this complex world of pharmaceuticals, where even the most trusted medications can betray us? Knowledge, my friends, is power. Always research your medications. Look for credible sources, read reviews, and stay updated with the latest news in the medical field. Talk to your doctor, ask questions, and be your own advocate. Don't hesitate to seek a second opinion if something doesn't feel right. Don't be afraid to speak up if you experience any unusual side effects. Reporting these can help others and contribute to the overall safety of medications. Remember, it's your body, your health, and you have the right to be informed and to make choices that prioritize your well-being. Empower yourself with knowledge and take control of your health decisions. Medicine is supposed to heal, not harm. Always weigh the benefits and risks before starting any new medication. Always research what you're taking, and if a drug seems too good to be true, it might just be the next big scandal waiting to happen. Stay vigilant and don't fall for marketing gimmicks. If you found this video informative, hit that like button, share it with someone who needs to know, and subscribe for more deep dives into shocking truths. Your support helps us continue to uncover and share important information.